Welcome back to Beyond the Headline, everyone. I'm so excited to have you on the show today because we're here with the founder of Progyny, Gina Bartasi. Gina, thank you so much for being here.
Yeah, thank you for having me.
I'd love to start out with an introduction to the work your team is doing and how you're totally redefining the fertility experience for couples.
Yeah. I think for many decades, couples probably didn't think about reproductive health. They got married in their mid-20s and had children and didn't have any fertility issues. So what Progyny really is doing today is tackling more of the macroeconomic trends as couples, same-sex and heterosexual couples, wait to get married and wait to have children. There's been a rapid rise in the need for fertility treatment. And that's really where Progyny comes in. Whether you're a consumer or whether you're in our large employer self-insured enterprise business, we bring what's called a Progyny Smart Cycle, which is a all-inclusive bundled program to the consumer. So our objectives are to increase success, decrease miscarriage, and decrease costs. And we've been able to do that and have a lot of fun at the same time.
Can you give us an example of what it would be like if I was a male or female who came to the site? How would you guys be able to help me?
Yeah, so there are a number of ways that you can contact us for to answer your fertility questions, or if you need help or advice or counseling. Certainly, telephonic is a way. We have Progyny app, so download it in the App Store or on your Android phone. Electronically, telephonically. And then certainly all of our email communication is HIPAA compliant, and we adhere to all the patient privacy regulatory environments. So you typically get connected to what's called a PCA, a patient care advocate, and they are trained in fertility. Several of them are geneticist experts. They may be third-party donor experts. They may be surrogacy or adoption experts, but there's a trained fertility staff. They typically know the providers in your network. So if you're in the Bay Area, they may ask more questions. Do you live in the East Bay or the South Bay, or do you live in Marin County? Because you will find when you go through fertility treatment for about 10 days, you are in and out of clinic, if not on a daily basis, every other day. So we do find patients that request convenience for the doctor. So you get connected with a PCA. They help patients all around this country, and certainly our goal in 2017 is that they'll be able to help international patients as well. But they walk you through what's involved in the treatment cycle. They connect you with a doctor. They talk to you about fees to be expected, what your employer may pay. If your employer does not have a sponsored program through Progyny, what you can expect to pay as a consumer. So they're really there. We call them concierge healthcare. So they're really there to guide you and make this really difficult process that's historically been opaque. They're there to be completely transparent and supportive with you.
And I think what's so nice about that, like I was sharing with you, I really didn't know a lot about the industry. And when I was looking, it seems like previously it's sort of been a black box.
It has. It has. It's been incredibly opaque. I think the reason for that is historically the fertility industry has always been cash pay, right? Most people don't think about reproductive health in an elective pay scenario. They would presume, well, my right to have a family is something that should be covered by the major health plans. And historically, that's not been the case. So managed care often does not provide for fertility treatment. There are 3 states in the U.S. that do provide some sort of mandated coverage. That's Illinois, Massachusetts, and New Jersey. But in the other 47 states, you're responsible in most cases to pay for it out of pocket. And the cost to conceive from start to conception average about $65,000. Yeah,
wow.
So, and that's for a traditional IVF cycle. Egg freezing cycles on average run about $10,000, plus meds are another $3,000 to $4,000. Depending on when you start your fertility journey or you start thinking about your family building plan, in the egg freezing case, we would encourage you to start thinking about it as a family building plan instead of waiting historically for your fertility decline to think about doing it earlier. In that case, you may only need 1 cycle of egg freezing versus 2 or 3 or 4 if you waited to start your egg freezing journey. So, again, prices are disparate in a geographic area. Again, because historically there wasn't a lot of transparency. Managed care has not played a big role in fertility in the past, and historically employers have not been inclined to provide for fertility treatment.
The employers is an area that you guys are really focused on, and I was shocked to learn that 1 in 8 couples struggle with infertility, and less than 30% of
Yeah.
their employers provide coverage for that. How are you helping the employers in that regard, and why do you believe it's important that they start playing a role here?
Yeah. So I think the smartest entrepreneurs and CEOs actually build businesses around customer needs instead of knowing the direction of their business. And what I mean by that is the real genesis and growth of this business over the last 12 to 18 months has been as a result of us answering the needs of the employer. So versus us going to them and solving their pain points, they've come to us and said, here are my pain points. Can we work together to solve them? And so that's really what the Progyny enterprise opportunity is. And they see two things. So there's more and more demand from their employees, from their members. Again, these are just macroeconomic trends as employees wait to get married, wait to have children. There's more interest on their part, so they are raising that to their benefits in their HR department. Certainly, most benefits and HR colleagues at the Fortune 1000 businesses want to add a new benefit, a new offering to take care of the demand or to address the demand they're hearing from the employees. So one box that these employers get to check is we're doing right by our employees, we're addressing their needs, we're being pro-family, we're being pro-female, and we feel good about this opportunity and putting this new benefit in place. The second need and the second checkbox that the large employers are now eagerly enthusiastic about is the ROI we're able to show them and provide for them. So one of the ramifications that's not been so positive about the growth in the fertility industry is twinning and multiples. I'm a mom of twins. I know lots of other moms of twins. I know some moms that have had triplets, some that couldn't have carried triplets and had to selectively reduce. Again, all of these multiples are ramifications of fertility treatments. So at Progyny, we're focused on technology. Yes, the employers are customers of ours, but really we believe the way to change the industry in fertility and get those high cost of those multiples down, the twins and the triplets, is to use technology. It's called embryo assessment. There are a couple of different tools that allows the clinicians, the doctors themselves, to select the single embryo that would be best for transfer. And then you freeze the other embryos. So again, if we're building this solution with the employers, two things are important for them. A, they want to be viewed as an innovative employer, so they utilize Progyny's benefit per recruitment retention tool. But B, these multiples from a healthcare cost are really driving up NICU cost, high maternity-related care spending, and the employers really need to get their arms around that dramatic increase in cost and how you reduce that dramatic increase in cost. The way you do that through a Progyny Smart Cycle benefit is you move the industry to single embryo transfer. And the single embryo transfer is through technology, embryo assessment tools, both PGS, pre-implementation genetic screening, and EVA, early embryo viability assessment test. EVA is proprietary to us, but again, it allows the clinicians to look at those embryos, assess those embryos, and then transfer embryos one at a time. When embryos are transferred one at a time, a singleton pregnancy is much better, much healthier for the mom, certainly much healthier for the baby, much healthier for the clinician. They still have really high success rates because you're assessing embryos ahead of time. And what's valuable to the employer is they're able to avoid all of these high NICU costs and high maternity-related care. So it's pretty game-changing what we're doing, and the reception from the employers has been overwhelming.
Can you share some examples of companies that are adopting these practices and really working with their team members?
Yeah, we have an NDA in place with our customers. You can guess, and then you could call their HR departments, but it is the innovative leaders in the Valley who were first and initial partners. They're early adopters. What's been fantastic about those early adopter relationships is They've made us a better company. They've helped us build the product. We've iterated based on their needs. And so now we see enrollment from large enterprise customers outside kind of the typical high-tech Bay Area customer. So we're getting ready to enroll 2 large media companies here in New York, a large CPG company in New Jersey, a big box retailer in the Southeast, a big box, a large telecommunications company that's in the Midwest. And so, again, if you go back to the 2 things, employers, and that doesn't mean high-tech employers, I mean employers in general, really want to do 2 things from a HR standpoint. A, they want to be innovative. They want to put a family-friendly benefit in place. And B, they want to save cost. And so that's why we're seeing the interest from the employer market, not only from the usual suspects in the Bay Area, but across the U.S.
And even during the time that you guys have really focused on this and, like you were saying, had all hands on deck the last 12 to 18 months, have you seen an increased interest?
We have. It's interesting, Progyny is my 4th startup, and for 25 years, you literally knock on doors selling products, whether that's advertising or media or whether it's a medical device or whatever you've historically sold. The reason that I feel humbled and confident about Progyny's growth is that this is the first product we haven't actively sold. The leads are actually coming into us. The inquiries and requests from these large employers are filling out a form on our website, progyny.com. And so we typically get 2 to 3 incoming inquiries a week from Fortune 500 businesses. Again, they see this pain point. They have 2 pain points that we're solving around. They're getting demand and interest from their employee population to put a more robust fertility benefit in place, a more family-friendly benefit in place. And B, the HR and benefits team is being requested by their financial colleagues to start looking at decreasing cost in the maternity-related benefits and the maternity-related care as it relates to multiples. So we're able to help the employer do both, check both of those boxes.
Do you think in the future that this will just be a prerequisite when someone's looking at a company?
I do. I think a couple of things. I think the industry will be able to help the industry move to single embryo transfer. So it will be a lot easier to digest companies adding a fertility benefit because the industry and Progyny is working in tandem with the clinical community and the providers so that we can have babies, singletons. Today, 1/3 of all fertility treatments ends up in twins or higher multiples, and the natural twinning rate is 1 or 2%. And so if we can get the natural twinning rate back from 1/3 of all fertility treatment cycles to 1 to 2%, then the employers have no problem putting in a fertility benefit. I think historically the challenge was, we're going to put this fertility benefit in place, and it was a limited lifetime benefit. Maybe it was $10,000 or $20,000. But the employee, the member, was responsible for navigating this opaque industry themselves. And that it created this perverse incentive. So if an employer offered $10,000 as a benefit, I mentioned from start to conception, the average cost is $65,000. That means the employee, the member, is on the hook for the balance of that treatment. It creates this perverse incentive to say, hey, doctor, can you transfer more than 1 embryo to increase my success rates? So if you can put in better technology through embryo assessment tools, move the industry to single embryo transfer, then it just stands to reason that more and more employers are going to put a fertility benefit in place, not only to help their employees and their members, given the demand by them, but it'll be an easy economical argument as well because you just won't have the twinning issue.
And when you learn about, at least when I did, you read some stories from couples who have gone through this, it's an incredible emotional, financial, and physical toll.
It is. And what creates the emotional, financial toll is all the heartache. Okay, so this is something naturally supposed to happen. You're supposed to be able to have children. And so no one ever thinks growing up, infertility is going to happen to me. I'm going to have trouble conceiving. Maybe it's a spouse's issue. Maybe it's a female issue. Maybe it's a shared responsibility, but they certainly don't think about that. So what creates additional anxiety is the multiple failed cycles, right? So you may have an IVF cycle. I can remember when we had our first IVF cycle, you always think you're going to have success on the first cycle, even though the doctor says, we're going to need 2 cycles or 3 cycles or 4 cycles to get you to your goal of having a child. You always optimistically think it's going to happen on the first cycle. And so it's typically not the first cycle. Again, that's the way that the average cost gets to $65,000. That's because the average number of cycles by patients is more than 3. It's about 3.2 cycles per patient. So again, it's this heartache. The toll that it takes is a failed cycle, and then you're not pregnant, and then you do another cycle the next month or the following month. You fail that. So it's the combination or the culmination of these failed cycles that increases the anxiety and the heartache. One thing that's been hugely popular and recently popular for the large employers is providing an egg freezing benefit in place. So the question then becomes, with all this emotional toll and this heartache and the miscarriages and the absenteeism related to miscarriage and the emotional trauma, is can we as an employer, can Progyny, can we as a society do anything to reduce that anxiety and reduce the cost of that anxiety, increase presenteeism at work? And so if you will, a lot of the failed IVF cycles actually goes back to a woman's egg quality. So there are a number of recent studies that have been published over the last 12 to 18 months that shows the fiscal costs as well as the emotional cost of having a baby via frozen eggs versus multiple failed IVF cycles. And every single case study, getting pregnant with those frozen eggs is a lot more effective than it is having multiple failed cycles. So you get rid of all that heartache, but it's also incredibly difficult to try to conceive with low ovarian reserve or eggs that are not very good quality. So we are advocating, we're seeing tremendous reception from the large employer groups to put an egg freezing benefit in place. I think, it goes back to member demand. So you're hearing and seeing many, many more millennials asking for an egg freezing benefit put in place. And then when you start running kind of the fiscal scenario of the cost to the employer, you're going to see that it's actually more affordable. It's a higher ROI to put an egg freezing benefit in place today than it is to pay for multiple rounds of IVF and have failed IVF cycles.
Specifically on the note of women freezing their eggs too, it's a super controversial topic. What's your take on this, and how do you guys approach it as a company?
Yeah, I think it was controversial. I don't know that it's that controversial anymore. It seems like egg freezing's kind of gone mainstream in the last 12 months. And if that means we had to take it on the chin for some of the controversy for being kind of innovative and first in that space, I know when Apple and Facebook first announced it in October 2014, there was some negative feedback in the press. Now they're looked at as market leaders, right? And so Intel announced an egg freezing benefit. Comcast announced an egg freezing benefit. So, you have to applaud early adopters and market leaders, but I don't think we see the controversy around egg freezing. And you see that just in the last, literally it's happened in less than 2 years, where there historically might have been a stigma from the patient or the member requesting egg freezing. That's gone away. Now it's it's mainstream for members to ask about an egg freezing benefit, and I think it's more and more acceptable. It's almost become the norm. We offer it, Progyny, we offer it as an option. The employer can choose to either add the egg freezing benefit or not. In every single case, our employers have added an egg freezing benefit.
Before these last 2 years, too, when you guys were just starting out or even just within knowledge of the industry, how did you personally as an entrepreneur deal with that skepticism? And do you have any advice for other entrepreneurs who are doing new things and people are looking on saying, I don't know?
Yeah. Yeah, I mean, I think a positive attitude and just remaining determined. The successful entrepreneurs that I know have a tremendous amount of grit to them, and they just won't take no for an answer. And so you just have to continue to be persistent. And I think as you get older, being an entrepreneur in your mid-40s is very different than being an entrepreneur in your mid-20s, and I've had the blessing of being both. The lows aren't as low. You've seen them before. And so you have less frustration to people buying into your vision or your idea. You really just look at them and think, well, you'll come around later. I'll go knock on some more doors. And in your early 20s, I started my first business when I was 27. When I heard no, it was very personal to me. And I think, entrepreneurs have to separate the constructive feedback they may be getting about a business idea than it's anything directed personally at them. So, stay determined. If you believe in your vision, have convictions, find other people that share those convictions. If you are the only one with that conviction, I would tell you that your business plan may not be plausible. Because if you're the only one with a conviction, you do have to have customers. So that if you have a business plan, so I want you to stay determined. That would be some of the advice I would give other entrepreneurs. But find people to help you that share that conviction. Again, if you can't find anybody that shares your conviction, then you may just have a poor business plan, and you may need to think about another idea or going into corporate America.
I'm glad that you mentioned your first business at 27, because you actually made the decision to leave your current job and build your own business. Why did you take the leap?
Yeah, both of my parents are entrepreneurs. I think I didn't know differently. It's always helpful in your 20s when you're young. Not knowing is good, right? And so I can remember my first job right out of college. It was straight commission, no health insurance, no base salary, no anything. And I was like, great, sign me up. And so I didn't know that there were other jobs that provided health insurance and generous benefits and a base salary and paid time off. I mean, my dad was as a general contractor builder, and my mother kept his books, and so they were, you were hardworking and humble from the beginning. And but you also then, if you are an entrepreneur, what's phenomenal about being an entrepreneur versus kind of taking that job out of college and working in corporate America, there is this tremendous emotional, personal, and financial opportunity that being an entrepreneur yields you that you would just never have gotten in corporate America. So, and that's why hopefully that's what motivates some entrepreneurs, is the ability to take big risks, but then also to see enormous returns from those risks as well. And so again, when I think about why I took those risks, not knowing is sometimes helpful.
What were those first 7 years like when you were building Atlanta Woman, Atlanta Jewish Life, and Catalyst?
Yeah. Again, I was young, and I didn't have I was worried what everybody thought of me. I was trying to be a pleaser. I was trying to be friends with employees instead of a mentor, a manager, or a leader. I was 27 years old. I didn't know better. The smartest thing I probably did is my business card said account executive instead of founder CEO, because we were selling into some big corporations in Atlanta. UPS and Delta Airlines and Coca-Cola were all big customers of ours. And so you couldn't say at 27 or 28 that you were the owner of the company. As we matured and as we got much bigger, then there's an overwhelming sense of pride from the large employers. Arthur Blank, that was one of the founders of Home Depot, who now owns the Atlanta Falcons, was extremely helpful to me and mentoring me. And he was always so gracious to me to say, what do you need? Similar to Bernie Marcus, Paula Rosput ran AGL Resources. Bob Nardelli ran Home Depot at the time after Bernie and Arthur had kind of turned the reins over. So, again, it was helpful to me to have mentors older than me in the business community And it did get easier. But starting a business when you're 27 years old, and I bootstrapped it too. We took on some debt capital to finance it. But I think if you, again, stay humble and stay determined, and be gracious along the way, you will find, I've mentioned just some mentors that helped me grow as a CEO and a leader, and I'm eternally grateful to them.
What did you learn from them? Like, is there one lesson that really sticks out?
The one lesson that really sticks out that I do tell is, so I was working nonstop. I was 33 years old, and they said, Gina, you got to get married and have children. And I was like, what? I'm 33 years old. This is fun. We were, Jane Fonda is another one I would add to the list, who was extremely generous with her time and her feedback. And I remember going to a party at Jane's house in Atlanta and just running into a couple of executives that night that said, and really what I feel a responsibility to as a leader now is to help the young generation behind me at Progyny and the other women that I talk to live a life with no regrets. And so it's extraordinary. I think I can name them. I mean, Paula Rosput, Christine Jacobs, I mentioned Jane Fonda. I mean, there are a number of these women who were a generation or two older than me that were really helping me not just have a professional career, but really have a really fulfilling life. And their number one lesson, both from women and men, was, hey, you might need to slow down and get married and have children. There's more to life than just a career. And that was the fact that they would open up to me and share that guidance. And so then I was like, okay, what does that next chapter of my life look like? And so again, I didn't have the confidence, I didn't have the knowledge in my early to mid-20s, but I was fortunate to meet some extraordinary mentors who helped me grow up and learn.
I love that. And one of the things you actually shared about that journey was when you had your business card say account executive, and Joanne Wilson had written that in her post about you a couple of years ago, which I loved. When did you learn to be so resourceful and think on your feet like that?
Yeah. Again, I think it comes from within and the environment you grow up in. I grew up in a small town in North Carolina, and I was the first in my family to go to college. And you just had to be resourceful. We were a middle income family. We weren't low income, but we weren't high income either. And so you're resourceful. And I think it did early on, and even today, it's made me a much better entrepreneur. The favorite line was, how you get champagne on a beer budget. And so today, we remain frugal, and I think that our investors appreciate that. We are in gorgeous office space in Tribeca in downtown Manhattan. We don't pay market rate because we're in a sublease. That sublease is up in 18 months. That means in 18 months we've got to find another home. It'll probably be another sublease. So we remain that kind of resourcefulness and ability to utilize capital wisely is something that colleagues, investors, bankers, anybody else has always appreciated. And again, that it comes from your upbringing is, how to manage cash wisely and how to, again, be resourceful and not be afraid to make the ask, whether that's to SunTrust Bank in Atlanta to debt finance your business or to UPS to take the back cover of Atlanta Woman magazine. So you just, you make the ask, and that confidence probably comes from your parents growing up. I had two of the best.
Do you have any tips for first-time entrepreneurs on managing capital? Because I know that's one of the biggest challenges young CEOs face.
Yeah, I think, so I'll tell you where I think historically the issue was, and then I'll tell you how I think that's changed. So historically the issue was women did not like math. We have a joke here, if you work for me, I tell them, if you're a girl, you're going to learn math. So, because historically, again, when I grew up, the guys were always in the science and math classes, and the girls were in the language arts classes, right? And historically, that's been the case. I don't think that's the case anymore. We have Harvard MBA interns now, and the girls today absolutely understand code, they understand math, they understand analytics. And so, that is the number one thing, regardless of gender. If you're going to be an entrepreneur, you better understand math, You must understand what a P&L is. You must understand what a balance sheet is. You can self-teach it. I mean, there's all kinds of videos and books and everything else you can read. But the number one thing, I think when entrepreneurs make the mistake of running out of cash is they're just not paying attention to it. They may not be comfortable in a CFO's office or around a balance sheet or in a P&L, and they're just not mindful of the cash burn. And then I think whether it's today or last year or 12 months from now, your focus, regardless, again, if you've debt financed or equity financed your business, you better figure out how to live without that money and how to get cash flow positive as soon as possible. Now, that's another struggle entrepreneurs make, because you also don't want to cash strap the business. So it is a fine balance between putting money into the business, seeing far enough ahead to understand how much cash you need to hit that right trajectory. So it's not easy, and there's not a right or wrong answer. I would tell you, some days we'll spend, some months we'll say we'll make a big bet and say, all right, let's spend our money in exchange for this growth. The other thing you learn as being a CEO is you're not afraid to iterate. You shouldn't be afraid to iterate, and you shouldn't be afraid to change that budget. So if you've spent money for 3 months and it's not having the intended outcome, it's not having the ROI that you anticipated or that you projected it would, you need to change that plan. And I think historically, people stay on the wrong path too long. And so having enough confidence to say, hey, I got it wrong, let's turn left instead of right, and making that decision quickly and fearlessly is tough, but the more you do it, the easier it gets.
I love hearing you share these insights, because you can tell that they've been gleaned from each of your experiences, which I think is fantastic. Last question for you, Gina. Is it more fun being an entrepreneur now, or was it more fun being an entrepreneur when you were in your 20s?
It's way more fun being an entrepreneur now. It just is. First of all, today we have these extraordinary capital partners. And so when I had mentors earlier, my mentors today are our board. They help shepherd and guide this company. They've seen a number of other portfolio companies have enormous successes. I also think being an entrepreneur in your mid-40s is way more fun than your 20s, because there is this huge fulfillment. You learn in your mid-40s to turn it off and turn it on. I do try and leave the office every evening at 6 o'clock. It's religious at 6 o'clock. I go home. I have family time from 6 to 7:15. I have dinner with my husband. At 8 p.m., I'm usually back online. And then from 8 to 11, 8 to 10:30, I'm working again. But I think that it's way more fun. Now, again, technology helps a lot. So I'll borrow a line from a customer of ours, and she said, it's more about work-life integration than work-life balance. So as an entrepreneur, it's very, very difficult. It's difficult to have work-life balance. So I love her idea. Again, this is one of our customers. She said, we really promote work-life integration. So, that means, you may have to work on a Saturday morning or a Sunday afternoon, but then you may kick off on Friday afternoon to go to a kid's soccer game. So, having a lot of fun.
I love that. And it's always an important lesson to hear that and also remember it when you find yourself getting back into the habit of working all the time. So thank you for sharing that. And thank you so much for giving us a glimpse into the work that you're doing and the many companies that are really leading the way and working with you guys to totally change the game for their employees and their team members. How can everyone, Gina, stay up to date with you guys? And if there's an employer listening in, how can they learn more and get in touch?
Yeah, so the best thing to do is to go to progyny.com, and that's PROGYNY.com, and then there's an employer page. So it's really easy to find us. There's a form that they can fill out online. So thank you for having me. We've enjoyed this, and so we'll look forward to more communication in the future.
Fantastic. Thank you so much.